OCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 25 minutes before 8 o'clock. Not a bad-looking Friday morning. The weekend looks really nice. Right now, 66 degrees. Temperatures today, tomorrow, and Sunday in the mid-80s, and lows each night in the lower 60s, it looks like. So not a bad, what would this be, the third weekend of October, right? Is it the third one already?
Second.
I lose track of everything. Dr. Adam Rubinstein is on the phone. He's been with us before. He is a board-certified and an award-winning plastic surgeon, and he's going to talk to us today about breast reconstruction surgery after breast cancer. Good morning, Dr. Rubinstein. It's good to have you back.
Guys.
Hey, good morning. Oh, I'm sorry. I didn't hear you the first time. Good morning.
Yeah, good morning.
Oh, there you are.
It's great to be back.
There you are.
You got me?
You got up early today. You always get up early.
Every day. Early is, not only is it normal for a surgeon to get up early, but I have young kids. And so we got to get them ready for school and all that.
Ah, okay. The one thing I was going to ask you that I wouldn't even know or have any way of knowing, and maybe that's a good thing, maybe I'm blessed, what is the concern of the woman who has had a mastectomy when she first decides she's going to try to have somebody like yourself reconstruct what she once had?
Well, first of all, we should point out it is Breast Cancer Awareness Month right now, and breast cancer is a shockingly common cancer. Almost 1/3 of all cancer that's diagnosed in women is breast cancer, and even more shocking, 1 in 8 women in their lifetime are likely to be diagnosed with an invasive breast cancer. So it's really way more common than anyone might imagine. I mean, shockingly so. And it's a terrible thing for a woman to go through when you're posed with this diagnosis of breast cancer. There's lots of treatments. Of course, you don't have to necessarily have a mastectomy and lose your breast, but frequently that could be the best option. And when you do that, women need to know that you can do an immediate breast reconstruction. It's a terrible thing to be diagnosed with cancer for one, and then you compound that with a woman being faced with losing their, part of what identifies them as a woman. Mm-hmm. And these are two terrible things to face at the same time.
Right.
The option of immediate breast reconstruction can keep that feminine identity, their body identity, their body image through the process. And a recent article has come out, and these kind of articles come out, unfortunately, periodically on a regular basis, where women that are choosing to have mastectomies or have their breasts removed for treatment of cancer, they're not always informed about the option of having an immediate breast reconstruction.
Is that during the same time right after the surgery before they come out of the operating room the reconstruction happens, or do they wait a little while?
Well, that's the difference between an immediate reconstruction or a delayed reconstruction. It used to be years and years ago, the standard of care was you'd treat the cancer first and, well, let's not worry about the whole reconstruction thing. That'll be nice, but let's treat your cancer. And that was kind of a callous way to look at it, with complete disregard for a woman's identity and her psychological well-being going through the process. But it was in the name of really concentrating on the very serious problem at hand, which of course is the breast cancer. But one does not have to be without the other, and that dogma, that kind of getting into a rut of doctors thinking, okay, treat cancer and then worry about reconstruction, well, that has led to this trouble introducing and trying to increase the idea of having an immediate reconstruction. Now, I've been in practice 17 years. And if you include my training in medical school, it's, I don't know, was it 25 years or so, something like that I've been in this world. And for the entire 25 years, this same discussion's been going on. And I remember I was surprised at it when I was a medical student, and I'm still surprised at it. I think a woman should know if she's going, any woman listening, any woman anywhere should know that if they have breast cancer, that first of all, it is frequently very treatable. And secondly, you don't have to choose to have a mastectomy or have the breast removed without having a reconstruction immediately. That is correct. An immediate breast reconstruction, to answer your question, means you go in to have the cancer treated and have the breast tissue removed, but at the same time, the reconstruction is done, or at least the first stage of a reconstruction is done, and you never live consciously without having your female form intact.
Wow. I had no idea that was what could be done. Now, could I just throw in the one word lumpectomy? If that's what happens, because that's one of the words, and we only know this because we talk to other doctors, and so if it's not the complete breast, is there still reconstructive surgery that might be necessary?
That's a great question. A lumpectomy, when you're faced with a diagnosis of breast cancer, there are a few treatment options depending upon the type of cancer that you're diagnosed with and how extensive it is. But lumpectomy is very frequently an option, and it could be a very good option. Lumpectomy could be with radiation or without radiation. It could be with chemo, without chemo. But a lumpectomy means you're just taking, it's kind of what it sounds like. Ectomy is to remove, and lump, well, it's a lump. And that lump is, of course, a little cancerous growth. And if you do that lumpectomy, obviously you're not removing the entire breast. Depending upon the size of that lump and the tissue that's removed, it may distort the breast. You might have a little divot. It could change the shape. And so some amount of reconstruction might be necessary, but you don't lose the entire breast.
When the girls get to be 16, usually in health class, they're taught the self-examination. Is that always accurate? I mean, if you don't feel something, could you still have the breast cancer?
Well, yes, except to say that, first of all, I think self-examination remains important. It was something that was started many years ago to try and help women help themselves rather than be at the mercy of just kind of going to your doctor, once a year or so and having an exam. It is something, even when you're in the shower, just washing yourself up with a little soapy hand, feeling the breast and seeing if you notice anything different, any bumps or lumps that are different. And then that's a reason to go see someone. So it's a good method for early detection. But yes, it's possible to have a diagnosis of some type of breast cancer without being able to feel a little lump or bump in the breast. However, I don't want people to get all scared and run out and think everyone has breast cancer. It is common, but one of the earliest ways to find it is with a self-exam. And of course, at the right ages, getting regular mammograms, ultrasound examinations for younger women with history. If you have a history of breast cancer in your family, your mom, your grandmother, maybe an aunt in the family has breast cancer, or something you need to think about a little more than someone that has no history of breast cancer. But I still think self-exams are very important, just to be familiar with your own body. No one's going to know your body better than you. And if you notice something that wasn't there, a couple weeks ago, then it's something to talk about.
So the one takeaway that I think I will get from this interview, and other people might get something else, but the fact that you can have the reconstructive surgery done immediately, that to me, I don't know how new that is to you, Robert, but that's news to me.
That's news to me. I didn't realize.
So the one question I have about that, and I guess we'll give the audience information so they can look you up and research more, but sometimes when cancerous tumors are removed, there's always this waiting period to make sure they got it all. If reconstructive surgery is done before that time period, does that affect whatever needs to be done during that time period?
Well, you raise a good point, but that's really more to do, for example, with lumpectomy, when you look to see the final pathology on the lumpectomy to make sure that it wasn't close to margins. There's certain types of cancers, when you do a mastectomy, you may want to see margins, but having an immediate reconstruction doesn't mean that you're unable to go back and take a little bit more. It just means you're preserving that female form of having a breast, and you can always go back and take a bit if you have to, but it's uncommon when you're doing a mastectomy in particular to have to go back and take more. It's kind of the purpose of the mastectomy is to remove the maximal amount of breast tissue and remove the risk of a recurrent cancer that way. So we don't worry about margins as much with a mastectomy as we would with a lumpectomy or certain types of breast cancers that perhaps affect the skin.
And when you do the breast reconstruction, is it all there, like the nipple?
Great question. That depends on the type of breast cancer, but that is actually a terrific technique when it's properly indicated. There is such a thing as a nipple-sparing mastectomy, and let me tell you, it is damn near impossible to create a realistic-looking nipple and areola entirely surgically that will last, particularly the nipple, but they just tend to shrink. So if you can preserve the nipple and areola complex, you're going to have a really beautiful looking reconstruction. And there are some results I would challenge you to know that anything was ever done to the breast, because it can really look great. So there are techniques, and something to discuss with your surgeon if you have the unfortunate experience of having breast cancer. Discuss the idea of a nipple-sparing mastectomy. They're more and more common these days, and the reconstructions can look fantastic. If you do have to lose the nipple and areola complex because of the risk of recurrence of surgery, they can be reconstructed. We use techniques like tattoo as well, which can really look incredibly realistic. So there are options, obviously, when you have to lose them, but it is possible to keep the nipple and areola and to do a nipple-sparing mastectomy when the particular type of cancer will allow that.
Sensitive topic, serious topic, but the information you gave us is top-notch. Thank you for sharing that with us. I would like the listeners to have information to look you up or to look into the topic more, and I'm going to ask you to tell us where they might find that.
Well, I would recommend that you can always check out information from the American Society for Aesthetic Plastic Surgery, the American Society of Plastic Surgeons, the ASPS, and ASAPS, the Aesthetic Society, just to find good, board-certified, well-qualified plastic surgeons if you're in the position of needing to find someone to help you in these type of situations. I think the main take-home message for today is that you should know if you have this diagnosis, you can have a reconstruction at the same time as the surgery to cure the problem, and never leave the operating room missing your natural form if that's important to you. And it's very important that people know that. I mean, it's been 25 years or so that I've been doing this, and we're still having the same discussions. The more people that understand that you can do this, the better, and be aware that's an option. I hope that all the listeners never face this, but if you do, know that this is an option for you. Get that immediate reconstruction. Have a conversation with your surgeon about that.
Doctor, what's some great information. Thank you. For the listeners, we did record this. It will be up as a video. You see a photo of Dr. Rubinstein, and just hear us. There's no real video. It's just audio with a photo. But the information is there. If you want to share it with somebody, just go to the WOCA YouTube page or to the WOCA Facebook page. YouTube's better because you can look it up. Facebook everything gets lost on Facebook eventually, right?
Yeah.
Dr. Rubinstein, thank you so much for being on the air with us this morning. Good stuff.
My pleasure. Thanks for having me.
All right, we'll be right back.